Cavities in kids is a big problem in America and throughout the whole world. In fact, it's pretty much an epidemic, kids' cavities. Something we see on a daily basis. Being a dentist in this town, we see a lot of kids, which we love. Kids are great, we love them. And dentistry in kids has come a long way. Much like biomimetic dentistry and early intervention dentistry has helped increase the health of our patients, we can now approach baby teeth or kids dentistry in a lot different way than is traditionally done. Traditionally, cavities in kids were very commonly treated by doing the little baby tooth root canals. These are called pulpotomies and pulpectomies. And then by doing the little stainless steel crowns over the teeth. Stainless steel crowns are just what they say. This little shiny metal that you put over the top of the teeth. And for the longest time, this is the best that we had. But now the science has progressed to where we can treat kids a lot more conservatively without doing root canals, without doing stainless steel crowns, even without doing shots. If we're treating these kids with small to medium-sized cavities, I don't have to give them a shot at all. We might just have to rub a little bit of the topical anesthetic, kind of like the Oragel along the gums, so that those don't get sensitive while we're working. But as far as a needle and a shot, we don't have to do that. And I love being able to treat kids without having to give them a shot, without traumatizing them, without having them have a numb lip for 3 or 4 hours. Because kids don't like that. You bring them to the dentist, you give them a shot, you hurt them, of course they're not going to want to come back. You're going to create a dental phobic person by doing that to them. Okay? So here we've drawn tooth with a fairly good sized cavity in it. Okay, this is a baby tooth. And I want to emphasize this is done with baby teeth, not adult teeth. Okay? So what I can do is I can go in and I can scoop out the majority of this decay on a kid, either with a slow speed drill or with a little tiny spoon excavator, a little scooper thing. We can go in and we can scoop out most of this cavity, and the child doesn't feel a thing. Okay? This is dead tooth. There are no nerves in this area. It's just like cutting a fingernail, just like cutting your hair. It won't hurt them. Okay? They may not like it, may make them a little uncomfortable because we're working in the mouth, but it's not because we're hurting them. Okay? And then we leave, on purpose, a little bit of decay over that tender part of the tooth so that we don't hurt them. This is done on purpose. We leave a little bit of decay there. And then this is treated chemically to kill the bacteria and arrest that decay so it doesn't continue to get bigger under the filling. Okay, this is done with ozone or some other antibiotics, what have you. There's a couple ways to do it. And then we can just place a very simple filling over the top of it. Okay, so now there's our filling in the tooth. That's been sealed off, walled off. It won't get any bigger. The tooth will be fine. The kid's not traumatized. Everybody's happy. Boom, job done. Okay. Now, a lot of times, if another dentist sees this, they'll see that we left decay under that filling. Well, that was done on purpose. So, if they say that that tooth then needs, or it needs a root canal, it needs a crown, come get a consult from us first. We'll probably say no, that tooth is fine. It's not getting any bigger, and all we're trying to do is preserve this tooth long enough for it to be lost naturally. These are temporary teeth, okay? The molars in kids only have to last till about age 12. Then they have to be they're lost naturally. So during that time, we're just treading water. We're just trying to keep these teeth around to preserve the space so the natural teeth, the adult teeth can come in with space and come in naturally. We're not trying to have these restorations be perfect. We want to do them quick. We want to do them painless so that the kids are happy and everything like that. Very different from biomimetic dentistry. Biomimetic dentistry, you're going to be sitting here for a while I fart around and make that tooth be as perfect as possible. Make sure that that tooth lasts for the rest of the patient's life. Different story with these. We're just trying to make the kids not hate the dentist and making sure that the kids don't get toothaches. Another thing is this can only be done with small and medium-sized cavities. If a child starts to get a toothache or starts to get an abscess, well, game over as far as not having to numb them. We're going to have to numb them, maybe pull a tooth, maybe have to do a baby tooth root canal, maybe even have to sedate them to finish that. I don't like to have to do that, but that's the job. We still have to treat the kids and help them be happy. But I'd prefer to see them when the cavities were small, easily treated, easily prevented, and without hurting the kid or even having to get them numb.